Thank you for joining me today. Please subscribe the channel and join me. We are going to learn more about addiction in psychiatric and substance disorders. Addiction and psychiatric disorders is a specialized area of a psychiatric practice that focuses on assessment, diagnosis, treatment, and prevention of a psychiatric disorders and addiction behavior. Substance usage disorder present a complex biopsychological illness that involves integration of the brain structure, brain reward system, genetics, and neurodevelopmental trauma and mental conditions and social environment and medical factors. The modern understanding of the substance usage disorder and addiction is a chronic, treatable medical conditions that involves the changes in motivation and rewards process and stress regulation and executive function and decision making. Psychiatric practice plays a central role in screening, diagnosis, medical management, withdrawal assessment, psychotherapy integration, recovery plan, and co-occurrent psychiatric disorder treatments. In this video, we are going to learn and explain the neurobiological addiction. Neurobiological of the addiction. We are going to apply a diagnosis criteria for substance usage disorder. We are going to perform comprehensive addiction assessment and recognize the intoxication and withdrawal symptoms. We are going to understand evidence-based treatment medications, and we are going to learn treatment coexistent psychiatric disorders, apply harm reduction and recovery principles, and we are going to learn management relapse prevention strategy and provide culturally respond addiction care. Fundamental of a addiction psychiatry defines addiction as a chronic disorder characterized by compulsive substance usage, loss of control over the usage, continued use despite the harm of liver failure, pancreatic inflammation, GI bleeding. There is a lot of harm that substance usage and addiction can cause that include the functional decline, cognition decline, physical decline, medical conditions. It also, so they continue usage despite the harm. They have the addiction also causes persistent craving. Functional impairment, it also causes medical diagnosis, is the substance usage disorder. So the substance usage disorder involves problematic use of a substance that significantly impairs function and causes stress. Common category include alcohol usage disorder, opioid usage disorder, stimulant usage disorder, sedative, sleep and anxiety, medication usage disorder, cannabis usage disorder, tobacco usage disorder, hallucinogenic related disorders, and inhalant usage disorder. Those are the substance usage disorders. Neurobiological of the addiction involves changing in several brain structure. It involves reward pathway. Reward pathway is the muscarinic dopamine pathway that play a central role. The important structure in the reward pathway include ventral tegmental area of the muscarinic dopamine pathway, nucleus accumbens, frontocortex. Substance usage increases dopamine signal production. Reward is reinforcement, motivation relapses, motivation repeat behaviors. There is a 3 stages that involve index. The 3 stages of an addiction circle involves the first stage, which is the binging and intoxication. Second stage is the withdrawal and negative effect. Third stage is the preoccupation and anticipation. So the first stage of binging and intoxication is associated with rewards, pleasure, reinforcement, and the brain structure that involves include the dopamine pathway and opioid signaling. Second stage of the addiction cycle is the withdrawal and negative effect. It associated with anxiety, irritability, dysphoria, and craving. Stress system becomes activated. Third stage of the addiction cycle is the preoccupational and anticipation. It associated with craving, loss of control for the addiction, and relapse risks, and executive function becomes impaired. Okay, there is a genetic and environmental factor that increase the risk of addiction. Addiction is a risk involved by the genetic factors that include family history, genetic vulnerability, differences in reward sensation. So people are different about how they feel with the substance. If they have a family history of addiction, they are more likely to be addicted. If they are vulnerable genetic, there is some people who have a vulnerable genetics, they are weak to addiction, they get addicted so easily. And environmental factors include the trauma. If the person have a trauma, they have a risk factors for addiction. If they have a childhood adversity, they have a risk for addiction. If they have a peer influence, if your friends are addicted, using alcohol, using drugs, you have a risk factor, so you have to stay away from them. Okay, availability of the substance. If the substance is available everywhere in your neighbor, in your environment, that's risk factor for you and for the patient. Chronic stress can lead to addiction and is the risk factor. Poverty is the risk factor for addiction. Social isolation can lead to addiction. Psychiatric comorbidity with addiction. What is the psychiatric comorbidities? Substance usage disorder commonly is associated with major depression disorder, bipolar disorder, anxiety disorder, PTSD disorder, ADHD disorder, borderline personality disorder, psychosis disorder. Those are the psychiatric comorbidity that go with the addiction. They are combined with the addiction. Okay. Clinical principles co-occurrent, like occur together. Co-occurrent psychiatric disorders increase the risk of the relapse, increase the risk of suicidal ideation, and increase the risk of treatment complex. Also, it increased the risk of the hospitalization risks. Also, both the psychiatric conditions and addiction conditions, both conditions must be treated. Okay, substance usage assessment. Substance usage and addiction assessment is a comprehensive addiction evaluation that includes substance history, psychiatric evaluation and assessment, medical evaluation, because the patient may have a medical conditions that lead to addiction and psychiatric illness. Social assessment, you want to assess if they have a risk factors, what is influencing their addiction. You want to also assess the risk assessment. What are the risks leading to substance usage, and what are the risks substance usage disorder is leading to? Okay, substance usage history. How are you going to assess the substance usage history? You want to assess the substance type that they're using. Are they using alcohol? Are they using opioid? Are they using stimulant? Are they using cannabis, or are they using sedative? You want to assess the type. You want to also assess the pattern of the usage. You want to assess the age of the first used for this substance. Frequent, how often they use the substance. Because the frequency they use affected the withdrawal. The substance they use, it affected the withdrawal, it affected the recovery, it affected the how that harmed their life is, it affected the addiction, how addicted they are. The frequency they use shows you how they addicted, how that affected their control, how the impairment, how their executive function is impaired because they are frequently using the substance. You want to also use the amount, because the amount that they use, it creates more issue for them, more issue. The amount of the alcohol or drug it can increase the damage to the organs. Road, are they inhaling? Are they drinking? Are they injecting? The road of the substance that they use, and you want to assess that. Also, you want to assess the duration. How many years they using? How many times they using? Duration, whole day? Do they use the whole day? Do you have a day? Do they use 1 hour? Do they use how duration? Recent usage, and you want to know the recent usage because the withdrawal begins when they stop the alcohol or when they stop the drug. So you want to know how recent is that. More they didn't use, more the withdrawal symptoms get worse, and they can go coma if they don't get treated. So you want to use the last time they've been using it. And then you want to prepare for the withdrawal symptoms. Consequence, you want to also evaluate the consequence of the addiction. How did this addiction affected their lives? How this substance usage affected their lives? You want to evaluate the relationship problems, if that affected their relationship with their parents, with their children, with their spouse, with their co-workers, with their school. You want to assess that. You want to also evaluate the work environment. Are they working? If this addiction affected their work? Mostly it affected their work if they are addicted and they are using substance. So you want to know work environment. You want to also assess the legal problems that they are going through. Do they went to prison for using this substance? Are they on probation? Are they on court holding? Are they commitment? You want to assess that legal problems that this substance cost them. You want to also know the medical complications this addiction causes. Medical complication, what I mean, do they have a liver failure, kidney failure? Do they have a pancreas damage? Do they lose their sight? Do they lose their teeth? Do they have inflammation? Do they have low weight? Do they have sleep disturbance? Do they have mental illness? Do they have injury? Because when they are intoxicated or when they are using, they can be injured by others, or they can be injured because they fall or they been harassed or killed. So you want to assess that medical complications that the substance is causing and cause. You want to use screening tools. What are the screening tools we can use? Screening tools we can use to assist the clinicians evaluate this substance usage disorders include alcohol usage disorder. You want to identify and assess the alcohol consumption. You want to assess the alcohol related problems, as I mentioned before, liver damage, pancreatic inflammation, GI symptoms, dependency symptoms, financial problems. And then for the drug abuse screening tests, you want to assess the drug related consequences, the problem that the drug use caused them. You want to assess the financially, relationship, work, school, life, and also their body. Tobacco screening, you want to assess the nicotine usage, how often they use, how many quantity do they use. You want to assess the dependency severity. You want to also assess the how many do they try to quit attempts. You want to assess that. You want to assess the when do you begin smoking, how many years you've been smoking, how much you smoke a day, package a day, half a pack a day, 2 pack a day, how many you smoke. Do you attempt to quit this smoking? And that shows if they try before and they try to quit. That shows you it's hard for them to quit. So it will be challenging, but still it can be quitted. And you can help them and educate them and guide them. Okay, diagnosis criteria for substance use disorders. Diagnostic requires problem pattern of a substance usage that leads to clinical significance of impairment. Clinical significant impairment and stress. Symptoms may include impaired control. Examples include use more than intended. They use more than intended. Some of them, they will say, oh, I wanted to use 1 cigarette, but I see myself using one package of cigarette. Some of them will tell you, I tried to use 1 glass of alcohol, but end of the night, I used 5 bottles. So that shows you they lost the control. So, and then you will also assess the difficulty to stop. Impaired control will lead to difficulty stop. Impaired control will lead to excessive time obtaining the substance. They will put all their effort and time and money and goals for gaining this substance. That is why it's addiction. Okay, social impairment. Social impairment, you want to assess the social impairment, how this addiction affected this person. Your example will be relationship problems. Do they lost the custody of their children? Do they lost the relationship with their parent? Do they lost the relationship with their loved ones? That affect, it causes relationship problems. Addiction causes failure at work and school. Addiction also causes a reduced activity. All the facts, because this person is addicted, all their effort and concentration is this substance, because they lost the control and they will lose, and they lost the social impairment. They lost the social contacts. Risks using. Risks using examples include using despite the danger. Using despite the danger of losing your liver, losing your teeth, losing your brain, losing your work, losing your school, and losing your relationship, most important relationship like the children, parents, and partner, spouse. Medicational pharmacology critical. Pharmacology criteria includes a tolerance and withdrawal. Pharmacology criteria includes withdrawal and tolerance. So the medication helps withdrawal and tolerance. You want to assess the severity of the addiction. You want to assess the severity, and the severity is based on the number of symptoms that the addiction causes. Mild, if the symptoms are mild, moderate, or severe. For example, alcohol withdrawal, alcohol usage withdrawal, alcohol usage disorder. Alcohol usage disorder is the one of the most common substance-related disorders, and it is associated with medical complications, psychiatric illness, suicidal ideation, and family destruction. Imagine you are drinking and that costs you medical complication. It costs you mental illness. It costs you suicidal ideation, and it costs the destruction of the family. And you know that, and you cannot stop because you are addicted. So you want to assist the patient about that. And you want to find a support and treatment. Clinical effects of the alcohol addiction include judgment, loss of the judgment, and judgment impair. It affected mood regulation. Person cannot regulate their mood normally. It affected their sleep, and it happens sleep disturbance. And also it impairs the cognition and impairs the control, pulse control. Alcohol withdrawal may include tremors, anxiety, insomnia, sweat, elevated heart rate and blood pressure, and agitation. And severe withdrawal may lead to seizure, delirium, which is a medical emergency, and it may lead to coma and death. Alcohol withdrawal assessment. Alcohol withdrawal assessment is important consideration of the time of the last drinking. That's why you want to ask when was the last time you drank, because the alcohol withdrawal begins with from that time. Previous withdrawal severity, how severe, you want to assess that, and you want to ask the patient how severe is that. How severe was the last time you tried to stop drinking, and previously withdrawal severity you want to assess, because you want to prepare for that. You want to monitor the patient. You want to mostly it is hospital unit that deals with withdrawal medication. And you want to ask the history of seizure. If they had a history of seizure, that increases now, because alcohol withdrawal increases the seizure and coma and death. Medical comability. You want to assess the medical comability, and medical comability includes the liver damage that we talked about, pancreatic, failure to derive minerals. Their minerals is mostly low. They lost the teeth. So you want to, if they have liver damage or kidney damage, what is the medical comability with the addiction, and what is the psychiatric illness combined with this substance withdrawal? Treatment of alcohol usage disorder. Okay, treatment of alcohol usage disorder include psychosocial treatment involving motivation interviewing, cognitive behavior therapy, multiple support groups, relapse prevention therapy. So it includes motivational interviewing, cognitive behavior therapy, mutual support groups, and relapse prevention. Mutual support groups, they are people who come and support them, and they've been sober. They come to AA meeting and they describe their struggle and skills and coping skills that they use, and that will be a support group for the people who are trying to recover now. And you want to have a relapse prevention strategy. Medication treatment include options may include opioid agonist medications and may include that may reduce the alcohol craving and reward effect. Alcohol metabolism modifier medications may support abstinence by creating unbalanced effect of the alcohol usage and consumptions. Glutamate maralin medications may support maintaining abstinence. So glutamate maralin medications may support maintenance. Opioid. Next, we want to talk about the opioid usage disorder. Opioid usage disorder involves problem use of opioid substance resulting in impairment and stress that includes a prescription opioids medication, heroin, illicit systemic opioids. Neurobiological opioids affect the opioid receptors, reward pathways, and stress regulation. Opioid withdrawal. Opioid withdrawal symptoms include early is the anxiety, restlessness, muscle aches, sweat, and later on it will create GI symptoms like nausea, diarrhea, vomiting, and insomnia. Evidence-based treatment for opioids is the standard of care. Opioid agonist medications provide control active of opioid receptors. Benefit of that medication is to reduce the craving, to reduce the withdrawal, and to decrease the overdose risks. Partial opioid agonist medications, the one we talked about was the opioid agonist medications. This one is a partial opioid agonist, provides withdrawal relief, provides craving reduction, and it lowers the overdose risk compared to full agonist. Opioid antagonist medications blocks opioid effect and reduces complete opioid withdrawal before initiating. So before they initiate the withdrawal, they can take that medication and it will complete opioid withdrawal before initiating. We want to talk about the stimulus usage disorders. Common stimulus usage disorders include cocaine, amphetamine, and meth. Effects of those stimulants include increased dopamine activation, elevated energy, reduced fatigue, and increased alertness. Withdrawal of that stimulant include depression, fatigue, increased sleep, craving, and suicidal thoughts. What are the treatment? The treatment currently emphasize behavior interventionists. Behavior interventionists, continuous management, and cognitive behavior therapy. We want to talk about next about the sedation and hypnotic and anxiety medications usage disorders. Example of those are benzodiazepine withdrawal, benzodiazepine usage disorder, sedative medications, they are addicted. So that's why they are usage disorders. The risk factors include dependency. Benzodiazepine has a dependency, and the symptoms mimic like the alcohol withdrawal. And they include dependency, cognitive impairment, fall risks, overdose risks. Risk increase with combining with the alcohol, opioid, and other substances. Withdrawal of the benzodiazepine and sleeping medication include anxiety, insomnia, tremors, and seizures. That is why it's mimic like the alcohol withdrawal, because they have a similar symptoms of withdrawal. Withdrawal management require carefully medical supervision because they could go seizure and they could go coma. Cannabis, we are going to go over cannabis usage disorders. Cannabis related problems may include impaired function. It's hard for the person to work or go to school or function normally, so impairment, functional impairment, cognitive difficulty, it's memory loss, memory fatigue, motivational memory, they will be lazy, fatigue, no goals, and that is the cannabis. And anxiety and mood get worse with cannabis. Depression, anxiety, mood get worse with cannabis. What is the treatment of the cannabis withdrawal symptoms? It includes motivational intervention, motivational interview, cognitive behavior therapy, behavior interventionist. Next, we want to go over with the nicotine usage disorders. Nicotine dependency involves craving, withdrawal symptoms, and difficulty stopping. Okay, withdrawal symptoms include irritability, anxiety, difficulty concentration, and increased appetite. People gain weight when they stop smoking or vaping. Treatment include behavior counseling, nicotine replacement approaches like the patch and gum and lozenge. Non-craving medications also exist. Intoxication syndromes. Intoxication syndromes must be recognized. Commonly present in the alcohol intoxication, stimulant intoxication, opioid intoxication. And how do you know? The symptoms of the alcohol intoxication include impaired coordination, slur speech, poor judgment, and mood changes. Stimulant intoxications include agitation, increased energy, increased anxiety, paranoia, and opioid intoxication is classic finding of opioid intoxication includes depressed respiratory, and decreased level of consciousness and construct of the pupils. That shows you they are going coma when your respiratory is depressed and your level of consciousness is going down. You are going to the coma. So you want to assist the patient about respiratory depression, cognitive changes, and pubic constructed. Double diagnosis treatment. Patient with a psychiatric illness and substance usage disorder requires integration treatment. And the principle is avoid treating only addiction and avoid only treating a psychiatric symptoms. Instead, you want to address both together. You want to treat both of them together. Example is patient with PTSD and with alcohol usage disorder. You want to treat both of them. And treatment will be trauma focused therapy, alcohol treatment, and medication management and recovery support. Motivational interviewing. Motivational interviewing is the collaboration counseling approach designed to strengthen the motivation for change. You want to motivate the patient to change their behavior, to change their habit, to change the addiction. Core principles include express empathy, develop discrepancy, role with resistance, support self-efficiency. So express empathy, you want to understand the patient's experience. Develop discrepancy is helping the patient identify between current behavior and their goal. If their goal is to graduate from school or university and have a successful career, and they are using alcohol or drugs, that is discrepancy. It's hard for them to reach their goals. So you want to help the patient to identify difference between their goals and their behavior. Rolling with the resistance is avoid confrontational. You want to avoid confrontational with the patient. How are you going to avoid that? You want to support them self-sufficiency. You want to strengthen their belief in ability to change. You want to also harm reduction recovery that reduces the health risk is important treatment goal. You want to have that harm reduction goal. Example will be overdose prevention education, safety usage education, infection prevention education, medication treatment accessibility. Addiction causes overdose risks and harm. Addiction causes unsafe situations and unsafe usage. Addiction causes and leads to infection, and addiction need a treatment accessibility. So you want to help the patient about those areas. Recovery-oriented care. What is the recovery-oriented care? We want to emphasize the hope. We want to emphasize the hope for the patient. We want to help the patient goal set up. Personal goals. We want to emphasize their personal goal. We want to create hope. We want to create meaningful and help them to see the meaning of their lives. We want to improve their function, and we want to help them to see that we want to also improve their quality of life, and we want to picture for them and educate them the quality lives that they can have if they recover from the addiction. Recovery is not limited to abstinence. Recovery involves a lot of steps, process, and struggle and steps to go through. Relapse prevention. Relapse prevention include identifying the triggers of the relapse, develop coping skills to prevent relapse, and create crisis planning. Identifying the triggers include stress. You want to identify if there is a stress situation that triggers the relapse, is there a trauma remembering that triggers the relapse, is there a social situation that triggers the relapse. You want to also develop a coping skills, and these coping skills examples include exercise, support systems like a friends, family members, group supports that can help the patient to recover and prevent relapse. And then you want to have therapy skills for the patient so they can improve their recovery and prevent relapse. And creating crisis prevention will prevent the relapse, and that includes emergency contact. When you feel you are going to relapse, this is the emergency contact you can call before you relapse or before you drink this substance or take this drug. So you want to provide the emergency contacts for the patient. You want to provide the treatment resources that can prevent the triggers and relapse. You want to also provide a safety strategy and teach them safety strategy they can use to prevent relapse and improve the recovery. Addiction, psychiatric, and suicidal risks. Substance usage significantly increases suicidal ideation. Risk factors that increases the suicidal ideation include toxicity, withdrawal symptoms, depression, previous attempt, because they have that experience of withdrawal and toxicity, they will be depressed and anxious and worry about the withdrawal, and that can increase the suicidal ideation. And also impulsiveness can increase the suicidal ideation. Accessible to lethal means can increase the suicidal ideation. Always assess the current thoughts and intent and plan and protective factors. What is the protective factors that is stopping you going through these thoughts? That is what you want to ask the patient, and you want to know, and you want to encourage them to use that protective factors. Clinical case study. I have here clinical case study. A 8 years old patient presents requiring help for opioid usage. History, they have a history of daily opioid usage. They have increased tolerance for opioids usage, and they have withdrawal symptoms, and they lost their job, and they are depressed. Wow, that is not good scenarios, but that is a typical. You want to assist the diagnosis first. You want to assist the opioid usage. The diagnosis will be opioid usage disorder and major depression disorder, because they told you that they are depressed. You want to assess the risks. You want to evaluate the suicidal risk, because they are withdrawal, they are lost their jobs, they are depressed. So you want to assess first the risk to themselves and others. You want to also assess the overdose risks, because they are withdrawal of opioids, and then you want to review the support system that they have that can be protective factors for the risk of the suicidal ideation. Treatment plan include medication for opioid usage disorder, depression treatments, counseling. It includes recovery support. It includes overdose prevention, education. It includes follow-up monitoring for the patient. Okay, we have the summary. Addiction is a chronic brain-based disorder, not failure itself. Always screen for suicidal ideation in the patient with substance usage disorder, because they failed their social contact, family, they lost their job, they lost their functional ability. That is why also they have symptoms of mental illness. They also have depression and anxiety. They also maybe have a limited support because of their habit that they lost the important contact and relationship in their lives. That creates a situation for increased for suicidal. So you want to assist that. Treat psychiatric disorders and substance usage disorders together. Medication treatment saves lives in opioid usage disorder. You have to remember that motivation interview, when it reduces confrontation, motivation interview reduces confrontational and improves engagement. Recovery goals include individualized and patient-centered. What brain system is the central to addiction development? This is the question. The reward pathway involves dopamine signaling and particularly muscarinic pathway. The second question is what are the four major diagnosis domains of a substance usage disorder? Four domains of the substance usage disorders include impaired control, substance usage impairs the control, substance usage impairs social contact, social impairment, impaired control, risk of using the substance, and the pharmacology criteria to treat the usage disorder. What is the primary evidence-based approach for opioid usage disorder? Medication treatment combined with a psychosocial support. Why is a motivational interview effective in addiction treatment? It is strengthens the internal motivation for change and collaboration after it strengthens the internal motivation of a change through collaboration and rather than confrontational. So motivation interview strengthens the patient's ability and lowers with the collaboration between the provider and the patient and lowers the confrontational and friction of both the provider and the patient. Why is the integration integration improves for both the co-occurrent psychiatric illness and addiction substance disorder? Because untreated psychiatric illness and symptoms increase the relapse risks and worsening a recovery outcome. Addiction psychiatric requires physicians and clinicians and providers to understand the substance disorder as a complex medical and psychiatric conditions involving neurobiological, behavior, and social systems. Advanced psychiatric addiction practice include comprehensive assessment, diagnosis, reasoning, withdrawal reasoning, and withdrawal recognition, evidence-based medication treatment, psychiatric psychotherapy, integration with medication, and harm reduction and recovery plan with the suicidal prevention. The goal of addiction treatment is not simply stop the substance. It is restoring the health and improving the functional and strengthening the relationships and supporting long-term recovery. So you want to improve, you want to restore the health of the patient restore the damage that the alcohol did to the body and cause the medical and health wise. You want to improve the functional ability of the patient. You want to strengthen the relationships for the patient. If they have a family that affected by the usage, spouses, you want to have a counseling, family counseling, so you want to strengthen that, and you want to create support system for the patient. You want to also support a long term. All these steps will help and create support, long term support recovery. Thank you for joining me today. Please subscribe the channel and join me again. Thank you.